Growing up near a health center in Chibali district, Proskovia Saba closely observed the work carried out by nurses. That experience made her dream of becoming a nurse when she grew up.
Just I was interested by the way how the nurses dressed when I was still young.
Over the years, she got more interested in what midwives do, and it has now become her purpose in life. She's an enrolled midwife at Uganda Health Center for Invented District.
Maternal and neonatal death to reduce.
This is one of the main reasons that trained midwives are tasked with, according to Mariana Jemba Mwanja, the country midwife advisor at the Ministry of Health.
The evidence is there. In countries which have reduced maternal mortality, it is the midwives. As long as we have the skilled person at birth.
Quite a large number of maternal deaths that we register occur out of the clinical facilities currently.
Professor Florence Naluyimba, an obstetrician gynecologist at Kampala Hospital, says anyone seeking to become a health worker must love the job.
But it takes extra patience to actually be a midwife. It takes extra commitment to be a midwife, because a midwife sits with a mother from the time labor starts.
Midwives will do just about anything. They do not only stop at that period or start at the period when the mother is about to give birth. Theirs is a process.
Even before pregnancy, a midwife provides services for preconception.
Because in this country we have not developed quite the culture of preparing ourselves before we become pregnant.
You may find a midwife alone at the health facility, giving antenatal to 60 mothers, giving delivery to 5 mothers a day. Family planning is waiting for that one. At clinic is waiting for that one.
In fact, even more. Because even during the pregnancy, she has to see that the baby is born free of HIV.
The midwife gives postnatal care to the mother and the baby too.
Within the first hour, we give after 6 hours, we give 6 days, then 6 weeks.
However, there are very few midwives.
We have approximately 7,000 midwives in this country who are offering the services, but we need an extra like 1,600 to fill the staffing norms of the structure for the Ministry of Health.
Proskovia says about 3 years ago, the community neglected the services at Uganda Health Center until the Uganda National Health Consumers Organization, UNHCO, intervened.
Uganda was almost collapsing in terms of service delivery, in terms of infrastructure, in terms of relationship. It was a decay, total decay. But currently, we are proud of Uganda.
Moses, a project officer in charge of maternal health with Uganda Health Consumers Organization, says the community now has more confidence in the midwives.
They even keep calling them, are you at the facility? Can we come now? They make appointments.
The health rights advocates have continued to make calls for midwives across the country to help improve maternal and child health. Proskovia says the demand for their services has gone up with the improvement in the quality of health care at Uganda Health Center 4.
The drugs we get, they may get finished in 1 month or 2 weeks.
The facility has little space to accommodate mothers during antenatal care and delivery.
In the past, they used it to deliver 12 a month, but now our figure is now always 170, 180. Our target is 200 per month.
This is just one of many other challenges.
We don't have blood. When we get a mother bleeding, and when you have nothing to do for her, the next step is transfusion. So we have to transfer that mother to Mubende or Mitiana, which is very far. The mother may lose life in the journey.
The only ambulance they have is parked most of the time because it's rarely fueled. The Ministry of Health has a nursing and midwifery section that seeks to look into these challenges.
Right now, the ministry with some supporting partners are constructing some houses. Of course, that's a long process. Midwives are being given updates in different areas, things like post-abortion care, PMTCT, newborn care, helping babies breathe, helping mothers survive bleeding.
According to UNFPA, effective health coverage can be achieved if 4 key areas are addressed. They include availability, accessibility, acceptability and quality on both sides, the patients and the health workers. Citing the Bangladesh example, 500 educated and deployed midwives can reduce maternal mortality by over 80% and decrease infant mortality by 75%. Scaling up midwifery services in Uganda remains a challenge in the short term due to the government's focus on infrastructure projects. Florence Naluyimba, NTV.